Palpitations have almost become a metropolitan disease. Everyone has palpitations. Everyone's pulse is high. Look, I'm excluding arrhythmias. Treatment of rhythm disorders is separate. You can consult your doctor about the most appropriate treatment for it. But you can eliminate the feeling of constantly rising pulse and palpitations that bother you throughout the day in 7 steps. And more than 90% of palpitations will disappear with these 7 items. You are at the desk, you are standing, you are working on a job. You feel that your pulse has increased and palpitations have started. Apart from rhythm disorder, you can end this palpitations with these 7 items. When palpitations start, the first thing to do is to sit and lean back. When we sit and lean back, we will feel less heartbeat. When we lie down, we can feel this palpitation in our neck, ear, head and abdomen. But when we sit and lean our back, we seriously reduce this feeling. Secondly, we breathe deeply. 4, 7, 8 breathing exercises. We mentioned this in our previous videos. We breathe in for 4 seconds, hold it in for 7 seconds, and exhale for 8 seconds. If you haven't watched it, be sure to watch that video. Deep breathing exercise is one of the best treatments for panic and anxiety during the day, and it is heart-friendly. When your palpitations start, do not forget to do deep breathing exercises in the second stage. Are you still feeling palpitations? We strain calmly where we sit. Look, no one notices. You don't have to show your palpitations outside in any way. We sit, rest, lean back, close our mouth and strain if you still have palpitations after the deep breathing exercise. And this straining activates the vagus nerve, causing the heart rate to drop significantly. Even during cardiac examinations, we may sometimes ask our patient to strain. We call this the Valsalva maneuver. The Valsalva maneuver significantly lowers the pulse and allows the heart rate to return to normal. You sat down, took deep breaths, strained, but the palpitations still continued, albeit slightly. In such a case, you can get help from coughing. Coughing will cause the heart rate to decrease in a way similar to straining. Coughing does not open the vessels in a heart attack, but in case of real palpitations, it can reduce the pulse. Next step, you can't stand still anymore. You still feel palpitations. We get up and drink a glass of cold water. Cold water will again stimulate the vagus nerve and lower the pulse. Hasn't it happened yet? We go to the bathroom and wash our face with cold water. Cold lowers the pulse. Let's say you did these 6 items, but you still feel your pulse is high. You still feel your heartbeat strongly, and you think that the decrease in speed is not quite enough. In such a case, what I would only suggest in the 7th step is massaging both sides of the neck. But keep your back straight and your feet stretched out, because massaging around the neck, there is a carotid artery on both sides of our thyroid tissue, on both sides of the neck. Massage of your jugular vein can seriously reduce the pulse through the baroreceptor mechanism. In fact, we sometimes use straining and jugular vein massage, which we call carotid massage, in the treatment of rhythm disorders. You can gently massage both sides of the thyroid tissue of your horn as follows. This will be seriously helpful in lowering the heart rate, but only do step 7 if the first 6 points didn't apply or didn't quite work. In fact, most of the palpitations will disappear in the first 6 items. Your pulse increased, you felt palpitations. Do these and eliminate palpitations. Don't forget to subscribe to our channel and turn on notifications. Goodbye.